assume no responsibility for the accuracy, completeness, or objectivity or usefulness of the information presented on our site. We do not endorse any recommendation or opinion made by any member or physician, nor do we advocate for any treatment. You are responsible for your own medical decisions. Now I'm going to turn over the introductions of our speaker to Martha Butterfield, the Program Coordinator of NJCTS. Marty?
Thanks, Kelly, and welcome to all of our attendees. Before I begin the introduction of tonight's presenter, I would just like to take a moment to mention that tonight's webinar marks the beginning of the 5th year of our Wednesday webinar series. From January 2008, when we started, through December 2011, we have had more than 6,000 individuals register for one of our webinars, and we are delighted that you all are joining us tonight. So it's with great pleasure that I introduce our speaker for this evening, Dr. Julie Ryan. Dr. Ryan received her Ph.D. in clinical psychology from the State University of New York at Albany. She is assistant professor at the Graduate School of Psychology at Fairleigh Dickinson University, Teaneck, New Jersey. Dr. Ryan was trained in dialectical behavior therapy during her clinical internship at Montefiore Medical Center in New York. She completed her postdoctoral training at the Institute for Anxiety and Mood Disorders at the NYU Child Study Center. Dr. Ryan's clinical work and research projects have focused on anxiety, depression, and disorders of emotion regulation in children and adolescents. Currently, she is starting up a clinical research project to test the effectiveness of dialectical behavior therapy strategies for children experiencing chronic irritability, hyperactivity, and emotional distress. She is a member of the Association for Behavioral and Cognitive Therapies and has presented locally and nationally on the importance of disseminating effective treatments for children and adolescents experiencing psychological distress. Dr. Ryan, we are delighted to have you, and I'm going to turn the presentation over to you.
Thank you so much. Well, tonight I'm going to talk a bit about emotion regulation and how we can help children and teenagers to understand their emotions and hopefully to reduce tantruming. Hang on just a moment. There we go. Okay, so why should your child or the children that you work with learn to manage their emotions and their feelings? Well, we know that it's important to understand our feelings and to be able to change how strongly we feel about things, because a lot of times it's hard to think clearly when our feelings get very strong, especially when we're younger. Strong emotions often lead a child to do something that might get them in trouble and make a situation worse. And feeling like your child can handle their emotions may help them deal with things in a way that's better for them. So how can we help children manage their feelings? It's important for young children and even for teenagers to learn to identify their emotions and label them. And they need to notice what they are feeling and when they are becoming upset to be able to actually be aware of what they're feeling before their emotions become too strong. And one way we do this is by observing and describing our emotions. And I'll talk more about this as we go. The second thing that is helpful in managing our feelings is reducing emotional vulnerability. And this includes helping the child to understand what makes them more prone to negative emotions. Just like adults, if we don't get enough sleep or if we didn't get a chance to eat, we're going to be more crabby and more prone to experiencing negative emotions. So keeping track of whether the child got to sleep at a relatively good time, whether or not they had time for breakfast in the morning, if they ate a lot of sugary foods after school and now they can't concentrate on finishing their homework, or if they're on medication, if they didn't get to take their medication. All these sorts of things can contribute to not feeling our best and leave us vulnerable to negative emotions. We'll also talk briefly about how to change uncomfortable emotions through action. And all of these skills that I'll be discussing today are taken from the cognitive behavioral tradition of therapy, and most specifically from dialectical behavior therapy, which was originally created by Dr. Marsha Linehan, a clinical psychologist at the University of Washington in Seattle. And she originally developed these emotion regulation skills for adults with extreme difficulties regulating their emotions, and sometimes those who showed self-harming behaviors. And in numerous research studies, she's shown that these skills have helped adults engage in more healthy and effective behaviors. So what I'm going to be presenting today are many of these skills that we have changed to be more developmentally appropriate than the original version of the adult skills. So let's talk a little bit about the importance of understanding emotions. Why do we need them? So first of all, emotions give us information about the world. They provide a signal that something is happening. So for example, if you are about to cross the street and you are stepping off the curb and you hear a horn honk and you're startled and you jump backwards, that startle is a signal that there's danger and your body responds accordingly. However, even though emotions give us a lot of information about our world, they are not facts. And that is something that is difficult to express, especially to young children, but should be told to children and to teenagers. Talk to them that emotions signal something to us, but they shouldn't be taken as absolute facts. It's just one aspect of the information that goes into the way we view the world. So we are not our feelings. Secondly, they're useful communication tools. So through our facial expressions, our body language, our tone of voice, we are able to communicate how we are feeling. And others are aware if we look sad with our face is in a frown and we are hunched over, that maybe we need comforting. So we communicate with our emotions. Emotions are also connected to action urges. So just as I mentioned a moment ago, the scenario of stepping off a curb and hearing a horn honk and being startled and jumping backwards, that is an action urge that is connected to the startled emotion. So being surprised and jumping backwards, that's very helpful when there's something dangerous there. But when an emotional urge or emotion is connected to an action urge that's not so helpful, we need to figure out a different way to handle that emotion. So for example, if a child's brother says something that angers them and their urge, which anger, the urge is typically to attack, attacking your brother might not be so helpful. So we're going to talk a little bit about how emotions are connected to these action urges and how we might be able to handle them when they're not so helpful to us. So how do we help children learn to identify and understand the emotions they're experiencing? Well, one way that we can help children and teenagers to identify and understand the emotions that they're experiencing is to observe and describe their emotions. Sometimes you can, this can be called noticing and naming. So observing, describing, noticing, and naming the emotions we're feeling in our body. And one of the ways in which we do this when we're working with children in therapy is by giving them a number of vignettes about other children, hypothetical stories, and we have them identify the emotion that the child is potentially feeling. And I'll just give an example here of the kinds of stories that we do give in therapy to give you an idea of what I mean. So story one, today is Emily's birthday. She is having a party with all of her friends, and her mom baked her favorite cake, chocolate with vanilla icing and sprinkles. Emily is feeling, and most children would say, happy, excited, something like that. Story 2. Julia was sitting in a bed when she heard a weird noise coming from her closet. Julia is feeling scared, nervous, worried. Those are the kinds of emotions that children will typically describe. Story 3. Sally woke up this morning and felt really tired. Her little brother came running into the room and jumped on her bed and asked her to play. She yelled at him and told him to get out of her room and said that she hated him. Later on, she felt blank. Usually children will say guilty, sad, bad. So the reason why we use these stories is to create a little bit of context for the children that we're working with. Another way that we can help children teach them about their emotions is through other kinds of games. So sometimes we will use emotion face cards. You can make these yourself by drawing different facial expressions onto index cards, or you can order them online, and you can do things like make 2 happy faces and 2 sad faces and 2 angry faces and 2 guilty faces, and then play a game of memory. And this is something that teachers can do as well in their classroom with students who are having difficulties identifying their emotions. So very young children, when they have playtime, these are some of the resources that you might have available, and encourage certain to play these. Another way to do this in a group, especially if you're teaching to a classroom, is when reading a story or talking about a story and asking as you go through, not just about what is going on in the plot, but how the characters are feeling right now. So that might be a way to engage young children in beginning to identify different emotions in others. With teenagers, often what we'll do in therapy is we'll take a set of Jenga blocks and we'll write emotions on each of the blocks. And then we add a rule to the game that once you pull out a block, you have to define the feeling and give an example of a time that you felt that feeling. And if you don't know what the feeling means, then you can look it up together. And you can do this in a classroom setting as well by dividing up the students into teams and giving each of them access to a dictionary or to Google, so that if they come across an emotion like exasperated, that they can look that up and learn a little bit more about what it means. And in this way, we're allowing them to discuss feelings, which the more we make it okay and less stigmatized to discuss our feelings, the more likely children and teenagers are to feel comfortable talking about them. But also, if they're able to observe or identify what different feelings are, they're more likely to be aware of what they're feeling when they begin to become upset. So for children who are having a difficult time managing their emotions, after we learn about the emotion and observing and describing our emotions, we move on to the next step, which is noticing how emotions affect all aspects of the decision-making process and problem-solving processes. So here on your screen, you'll see describing emotions, the wave. And we'll often have children and teens, when we're working with them in therapy, take a blank worksheet like this one, and they bring it home, and we ask them to complete it very soon after an emotion occurs. And what we show them by going through this kind of worksheet is that an event or something that triggers an emotion will then affect how the rest of the scene plays out. So, for example, if a friend makes fun of the child's new haircut, the feelings that the individual might have are anger, their face and their body changes, they'll have physiological reactions like their face might turn red, they might feel hot, their muscles might get tense. And this leads to them having thoughts like, she's being mean and is a terrible friend. And then along with those thoughts are urges of what they want to do and what they want to say. And this is related to our automatic urge that goes along with that emotion. So in this case, with anger, it might be to verbally attack the other child back, making fun of her clothes. And then that leads to an action. And the child decides whether they act on their urge or whether they act in a different way. And in this case, in this scenario, we could say the action could be, I told her that she hurt my feelings. Or another action might be, I made fun of her. And then 5 is consequences. And that's seeing what is the result of this wave of emotion. So if you chose the action of, I told her that she hurt my feelings, the consequences might be that the friend apologized. The feeling-related consequence might be that you felt less angry, that your face felt less hot, and as far as rewards and punishment, the child may feel, I didn't get into trouble. Whereas if they acted along with their urge, their anger urge, to make fun of the other child, they may have gotten in trouble with an adult in the situation. They may have broken the friendship for a little while. They may feel sad. They may feel more angry. So we discuss how this one activating event sets off an entire wave of feelings and thoughts and urges and actions and consequences. And once we teach the child to identify how this happens, we then show them that they have a choice on how they react. They might not have a choice about how they feel, but they do have a choice about how they behave. So what we have them do is notice the feeling, step back to get some perspective, and get unstuck from their automatic reactions. So some of the things that we try to teach children is to remember that they're not their feelings, that they do not have to do what their feelings want them to do, that they're not always going to feel like this. So it's a wave. It comes and it goes. They feel angry now. In 20 minutes, the wave will probably have rode out. They won't feel like this forever. So sometimes also they need to feel all of their feelings, even the negative ones or the uncomfortable ones. So even though they would like to be happy all the time, unfortunately, we sometimes need to feel all of our feelings. We also want to teach children how a feeling can come and go, and that they should notice how long their feeling is going on for. And you might point it out to younger children, saying, I bet you won't feel like this for very long. And you could even point to a clock and make it more concrete for them and say, I know you're feeling like this now. Let me know when you've stopped feeling like this, and we'll see how long it took. So that might be something a parent or a teacher could do with a child who's becoming upset. Also, we want them to not try to push the feeling away. Our feelings are a part of us. So we want to be able to experience all our feelings. And when we try to push something away, usually we get it back double time. So we want them to accept the feelings that they're having, but not to feed the feeling by doing what it wants. And they can try to hold on to the feeling that they're having, to feel it all the way. And finally, although this seems a little strange, and it probably will to them the first time you say it, is to always love their feelings, because they are a part of them. They're part of their experience in life. Now, this is another example of a skill that can be helpful in regulating emotions. And usually how we teach this in therapy is through role plays. And when working with teenagers, along with the role plays, we also use worksheets with the teens. And the key here is first to figure out the emotion you're feeling. And then to ask yourself, or to have the child ask themselves, if the emotion makes sense for the situation. If it does make sense, is it justified? Is it effective? So, for example, if someone has made fun of your new haircut, feeling angry may be justified, but is being angry in that moment effective? If if the child is unable to act on that emotion in a positive way. So once we identify what emotion we're having and whether the emotion makes sense for the situation, we then figure out what action goes with this emotion. Usually, this is what the urge is telling the child to do. So as you see here on the slide, feelings of fear, our action urge is to run away, hide, and avoid. So if we were being chased by a grizzly bear, we would want to run away and hide. When we're angry, typically our action urge is to fight or attack or be mean, call names. Sometimes it can be to shut down and ignore the other person completely. So action urges are different for everyone. The next one is sadness. This one is often about withdrawing or shutting down, hanging your head low, crawling under the covers. That's the urge that tends to go along with sadness. And shame or guilt often goes along with the urge to hide or avoid the shameful situation. Now, when we're teaching this skill of opposite action, we have the child or the teenager figure out what emotion they're feeling, if they want to change that emotion, what urge goes along with it, and how to act opposite to that urge. So figuring out the opposite action is hard at first, but once they're well versed in what to do instead, is basically identify what they really would like to do and do exactly the opposite. So if you want to run away, you face your fear. You get right up into that situation and face it. If you want to fight and attack and be mean, you either avoid the situation or be gentle, nice, kind, and understanding. Now, when we ask children to do this and act opposite, we want them to do it all the way, not halfway. And what I mean by this is that we want them to embrace the opposite urge and act in that way so that they're not being nice and kind and giving a dirty look. They're being nice and kind and acting 100% in that opposite way. And they continue doing the opposite action until they notice that original emotion decreasing. And often when I first explain this to teenagers or parents and even sometimes to children, they initially say, well, wait, but I'm not being genuine. And sometimes acting opposite is not genuine. Instead, what we like to think about it as is it's your choice to be in control of a more effective way to handle the situation. And you genuinely want to handle the situation in a different way and potentially have that uncomfortable emotion decrease. So in that way, you're engaging in a skill that is in line with what you want to achieve. So one of the ways that we teach this, and that if you were to try to help students or to help your child to teach this, is to give them with different scenarios and to try to identify how they're feeling. And it usually helps to give scenarios first about other children because it creates some distance between what their concerns are and what their emotions are, and how to learn this skill. And it's much harder to learn when your emotions are active. So using a scenario about someone else is much better at the beginning. Eventually moving to teaching the child to notice it in themselves and identify their own urges. So here's one example scenario. Michelle was hanging out with her little sister Angel on Saturday. She was waiting all day for her mom to come home and take them to the park so she could go on the swings. As soon as they got to the park, Angel ran over to the swings and jumped on the only open swing. Michelle ran up to her, screamed in her face, and pushed her off the swing. Michelle's mom gave her a timeout, and she wasn't allowed to use the swing for the rest of the day. Now, if you're working with a group of children in person, not in a worksheet form, I mean, so in a group, for example, you could say, show us without words how Michelle was feeling. And most of the time they'll show angry faces with tense muscles and maybe gritting their teeth. If you're working with an older group of kids, you could always say, describe to me how Michelle's feeling. And then you want to know what unhelpful action urge might Michelle have been having at that moment. And finally, what opposite action might have helped her in that moment. So using these kinds of, this strategy of opposite action can actually be very helpful once the child learns how to recognize their emotion and the urge that goes along with it, and then engage in the opposite of it. Now, this skill, or these skills I should say, is a big one for parents and teachers to have some impact on. And this is going back to the idea of vulnerability to negative emotions. So these skills hopefully reduce vulnerability to our negative emotions, which when we have less vulnerability, we're less likely to act on these unhelpful urges. So I like to think about these skills as creating a force field or a bubble around the child, so that when you have these skills intact, that the force field works and the negative emotions and the negative events that might trigger these emotions just bounce off the child. But that when these skills are not in place and we are not engaging in these kinds of healthful behaviors, that unfortunately there's holes all through the force field and all through that bubble, and instead the events come in and are able to impact the child over and over again and cause them much more distress and vulnerability. So the first one that I like to think of in our force field is physical health. Helping your child or helping the students in your class take care of their health and body by making it important and that they know that they should brush their teeth, wash their hands, shower, that when they are physically ill, that they should tell their parents and they should see a doctor if needed. This is another big one, eating healthy. So eating healthy foods like fruits and vegetables and avoiding things like fast food or sugary foods and sodas. And also, especially with adolescents, not eating too much or too little. Because we do know that when children eat too little, that they can be irritable and have a poor time concentrating. And when they eat too much, they tend to feel lethargic and sleepy. Another thing is to avoid drugs. And hopefully this is only an issue for the teenagers, but avoiding drugs and alcohol and cigarettes, anything that might alter the way they normally feel. And sleep. This is a huge one, getting a good night's sleep. So trying to encourage children to get the amount of sleep that helps them feel good, not too much or too little. So for children, having a regularly scheduled bedtime and making sure that they stick to their bedtime and that they're getting a regular amount of sleep. And especially for teenagers, not sleeping the entire day on Saturday or staying up trying to finish their homework until 3 o'clock in the morning every night. And then finally, exercise. Exercising every day, even if it's just walking for 15 minutes. And with younger children, doing sports, signing them up for organized sports, playing active games with their friends, encouraging them to do something other than playing a video game or watching a movie or TV, and getting them active and moving. All of these things help contribute to their well-being and reduce their vulnerability to these negative emotions. Now, this is something that when working with younger children, like elementary school or even middle school age children, that if teachers are having a hard time at school with a child's behavior, they may want to have the parents journal how their please skills are doing. So for example, a parent and a teacher might have a notebook going back and forth where the parent will note what time the child went to bed and whether or not they had a chance to have breakfast that morning, or whether or not they are participating in different physical activities. So for example, in the past I have found that often when teachers and parents are journaling back and forth, they'll find a correlation, this relationship between nights that the child was refusing to go to bed or couldn't get to bed for some reason on time, and those are the days the next day at school that they have a really tough day and they have a really hard time regulating their emotions. So that might be something, if you're become aware of it, that it can be like bedtime's non-negotiable and there's no exceptions to bedtime if this is something that makes your child particularly vulnerable. Next, I want to talk a little bit about validation and mindfulness. And parents and educators can help children and teens to be more open to what you are saying to them by using validation. Basically, validation, it sounds simple, but it's not. It's letting the child know that you understand his or her feelings and that you hear them. So you can disagree about how the child or the teenager is acting, but still understand that emotion. So, for example, you can understand that the child is frustrated and let them know you understand, saying, I understand you're frustrated and that I want you to do your homework when your favorite TV show is on, and we have to start working on it now if we're going to get to bed on time. So you can understand that emotion, validate that emotion, and at the same time not agree with their behavior. So if they're throwing a tantrum and you need them to be doing their homework, it doesn't mean you accept their tantrum. It means you accept their frustration. And while you're doing this, you try to be non-judgmental. And you do that out loud to the child by observing and describing without judgment. So saying, I notice that you're frustrated, or I understand that you're frustrated, or I can't imagine, if this is the case, I can't imagine how you feel right now. Acknowledging the fact that they're having an emotional reaction. The next thing is no buts. And what I mean by this is not to use the word but when you're trying to validate your child or the children you are working with. The word but tends to negate the first half of a sentence. So if you're saying, I understand you're frustrated that I want you to do your homework and you want to do TV, but we have to start working on it now if we're going to get to bed on time. It basically puts a line through the first part of that sentence or that statement. It's saying, I understand you're frustrated, but I don't care. We need to do this homework. Instead, if you can replace those buts with ands, you can make a huge difference in the way that the child hears what you're saying. So if you say, I understand you're frustrated, and I'm sorry, we have to start working on your homework now, it gives a completely different feel to the child that these are equal. You being frustrated and our need to start homework are just as equally important. And even though it sounds like it's not that big of a change, it really can have a big impact in the way the child hears you. Be mindful also about your own emotions when you're with your child or the child you're working with, because we are human too, and when we start to get upset, we have a harder time being able to validate the child, and also to be able to use our strategies as effectively as we could. So you and I need to be mindful of how our emotions are rising. If we're becoming frustrated, if we're becoming angry, to take a step back and try to take a break, even if it's just for 3 minutes, to refocus ourselves and then come back in the situation and continue. And finally, validation is not as easy as it sounds. It sounds as though all you need to do is label an emotion. However, it's the way that you do it and the way that you genuinely care that your child is feeling that emotion or that your student is experiencing that emotion, whether it's frustration or anger, And this is something you'll have to practice to get the hang of. Okay, and finally, something that is very related to emotion regulation, which is tantrums. So these are some tips about curbing tantrums. And one of the biggest things that is important when trying to decrease the amount of tantrums a child is experiencing is using consistent and effective discipline that's fitting to the misdeed. And what I mean by that is that you should determine ahead of time for routine types of offenses like not finishing homework on time or not cleaning up after themselves or leaving their bed unmade, to have a routine consequence in place that they know they're going to have if they do not do the task that they need to do, or they do not behave in the way they need to. And when you give the consequence, that you stay calm and have conviction while giving out the punishment. Now, when I say discipline that is fitting to the misdeed, that means if the child is has not cleaned up his toys, that you don't ground him for a year. Instead, you may give him a timeout or say that he's lost some of his TV privilege for the following night. And why we say consistent is because children and teenagers get very confused if sometimes they get in trouble and sometimes the rule is not in effect. So to keep them knowing that when they do a certain thing, they will have a consequence, we need to be consistent. And this is the hardest part of disciplining children. The second thing is try not to be angry with your child. When they throw a tantrum, they are just using a way to get their needs met. And most of the time, this has worked for them. Not saying it's worked all the time, but they probably had a time where throwing a tantrum got them what they wanted. So right now they're throwing a tantrum because they're hoping it'll get them what they want. Now, when you're in the situation, you absolutely should validate their emotions, and at the same time, don't give any threats. And what I mean by that is, if you're not going to be able to give the consequence, like for example, you say if you don't quiet down, you're going to get a timeout, but you're riding on the subway, and you know you're not going to be able to give a timeout on the subway effectively, then don't threaten to give one. Give an alternative consequence. Like say if you don't quiet down in the next 10 seconds, when we get home, you're not going to be allowed to watch TV, or you won't be allowed to play your Xbox. So don't give a potential consequence that you know you can't follow through on. Now, one of the most important things about curbing tantrums is to expect that they will get worse before they get better. So anytime there's a behavior you want to see less of, like a tantrum in this case, adult, anyone, an animal in a laboratory, they will try harder and harder because it's no longer working. So this is kind of a last-ditch effort to get this mechanism that used to work again. In learning theory, this is called an extinction burst. So right as a behavior is about to become extinct because it's no longer getting what it used to get, there's a burst of activity to try to see if we can prevent its extinction. So the child will tantrum a lot harder and longer, and you should expect this. But this will only happen temporarily, and if you are consistent with your consequences, they'll realize that even tantruming harder and longer will not get them what they need. For two-parent households, it's really important also to present a unified front in front of the child or teen. And what this means is that you want to even if you don't agree on everything, which it's almost impossible to agree upon everything, is when you don't agree to not have that conversation in front of your child. So if you don't think that this behavior that your spouse or that your partner or that your mother who's helping you raise your child is a problem, but you find it to be a problem, or they find it to be a problem and you don't, then you need to have a conversation about how to handle this and whether or not this is a battle you want to fight with the child, and decide what appropriate consequence, or whether you're going to just ignore the behavior. So this is something that you don't want to do in front of the child or teenager, because you want to show them that you are on the same page together and that you support one another and that you are together the parents of this child. And finally, and probably the very most important thing, is to praise positive behaviors. To praise these behaviors, you can notice them out loud when the child is doing something good, because your attention is the most important thing to your child and your teenager. So by noticing, saying things like, I really appreciate how hard you're working on your homework, or I noticed that you were really nice to your brother earlier, giving hugs, high fives, a genuine smile. This kind of genuine praise is the most important thing that your child and your teenager crave. And to give them any chance you have of noticing a positive behavior, or even effort or steps towards a positive behavior. So for example, you want your child to clean up their room and keep their clothing off the floor. If you notice them putting one sock into the hamper, to praise that first step, and then to move forward in being positive. These tips could also be helpful for teachers who are having students who are having tantrums in their classrooms. If this is a problem at school, it would be helpful for teachers to coordinate with the parents that they may need to have a behavioral plan put in effect at home. So something where the child is has a consistent plan of what kinds of privileges they lose, or a point system put into place, or a sticker chart if the child is very young. And the teacher can keep track of their behaviors in school with a journal. And if the child is young, they can give them stickers for certain points in the day, like if they make it through circle time and they had good behavior, they get a sticker. But if they had a tantrum, they don't get a sticker. And then that goes home at the end of the day for the parents to reinforce, or to be aware of the concern about and potentially have privilege losses. So these are some tips that hopefully will help in decreasing the likelihood of tantrums. Now, if your child is having difficulties, or teenager is having difficulties that are beyond the scope of just a couple of helpful tips, there are a number of evidence-based treatments for children and teenagers who are having difficulties with emotion regulation. And what evidence-based means is that there is some scientific research that has been done to show that these treatments are helpful. And among these are all in the category of cognitive behavioral therapies. So for younger children and parents, some of the following programs have been shown to be very helpful in decreasing tantrums, increasing compliance at home, and for helping children develop better emotion regulation skills. And a lot, you can look these treatments up online, and some different service providers like psychologists or social workers in your area may be providing these treatments. One is called parent-child interaction therapy, another which is usually used with children who are elementary school aged or younger, parent management training, which is used with all ages of children with parents, The Incredible Years program, which is often used in schools and involves teachers helping children to regulate their emotions and increase their attention and understand their emotions better, and it also has a parent component to involve as well. And then we also have treatments for teenagers and parents. There's functional family therapy, in which the system within the therapy, or the system within the family is examined, and there isn't necessarily one identified patient. However, instead, the whole family works to come back into balance so that there's a more effective working relationship among all members of the family. And then there's dialectical behavior therapy, which I talked a little bit about today, some of the skills. This has an evidence base in adults, and there's some research being done currently in adolescents. So it's based in that tradition, and some psychologists will offer skills-based groups or dialectical behavioral therapy, informed therapy, Multisystemic therapy is more for teenagers with very difficult conduct problems and involves the school system, social work agencies, community agencies, and if your teenager is having a lot of difficulties in all areas of their life, multisystemic therapy might be the way to go. And just one last comment on dialectical behavior therapy. Often this has been shown to be helpful with suicidal and self-harming teenagers and adults. However, the skills obviously can be very helpful with others as well. Now, often when children have difficulties with emotion regulation, they have co-occurring attention deficit hyperactivity disorder. Now, this is not always the case. It's just a common co-occurrence. So when that's the case, medication treatment for ADHD along with cognitive behavioral treatments have been found to be effective. So those are some of the recommended treatments for dealing with real struggles with emotion regulation. And finally, I wanted to give you some resources that if you would like to look into these to see if you can help your child or your students, there's a great book called The Explosive Child, A New Approach for Understanding and Parenting Easily Frustrated, Chronically Inflexible Children, and that's by Ross Green, who has an entire treatment approach that he uses with very dysregulated children. And another book that has been excellent and parents have told me has been very helpful is Parenting a Child Who Has Intense Emotions, Dialectical Behavioral Skills to Help Your Child Regulate Emotional Outbursts and Aggressive Behaviors. And finally, if you'd like further resources on some psychological services in the area, we have a Center for Psychological Services at Fairleigh Dickinson University at the Hackensack campus. The NYU Child Study Center has a Hackensack site as well as a Manhattan site. And in general, providers can be found at the Association for Behavioral and Cognitive Therapies. There's a Find a Therapist aspect to the website. And I am also currently seeing private patients at the Fairleigh Dickinson Center for Psychological Services and in Manhattan. So those are some of the possible resources. And at this point, I'd love to take any questions you might have.
Well, Dr. Ryan, thank you. A lot of great information, and I have to tell you, we are swamped with questions. So we'll try and get to as many as we can in the time that we have left.
Okay, great.
There's a theme that has come up in questions several times. And the question kind of relates around when you see a problem coming, you know, what can you do to prevent the outburst that is almost certain to follow? You know, how do you jump in when it's already started?
Okay, and that usually would be when we were talking about observing and describing of emotions.
Yeah, I just want to interrupt 1 second. You're fading a little bit, so if
Okay.
you're moving away from the phone or whatever, could you not do that, please?
Sure. Can you hear me now?
It's a little bit better.
Okay. So when we were talking earlier about observing and describing emotions, this goes on into a skill that's called mindfulness. And it's a very difficult skill to learn, but it starts with observing and describing emotions. So to practice that with your child when they're not upset, to practice them observing how they're feeling, how their body reacts to certain things, and then to start cueing them when you see something coming up, where you see that there's a tantrum that's about to happen, to have them notice how they're starting to feel so that they might be able, before they're getting really, really upset, to use some of the skills that we were talking about today. So that might be engaging in an opposite action sort of skill, or becoming aware that they can choose a concept, they can choose an action that isn't along with the emotional urge that they're going to have. So making them more aware, mindful of that emotion as you see that the tantrum is about to come on. And sometimes if this is something that your child, after working with them a bit, has difficulty with, this might be something that you have a therapist work on with them.
Okay, so the mindfulness then is on the part of not just the kid, though. It's on the part of the parent, too, to be really tuned in to the triggers and be proactive,
Absolutely.
correctly proactive before it really takes off.
Right, and cueing the child to notice, because it's a lot more difficult for them to notice what's about to happen before their emotion gets too strong.
Mm-hmm. Okay. Would you speak a little bit about how to handle a situation when the person that needs to be proactive, and I'm assuming that this is the adult, is more reactive and can't get to the point of even beginning to use any strategy because they just get plugged in immediately to the behavior?
That's a really common thing that happens. And often when I have this as a difficulty with a family I'm working with, I try to help the parent, or I recommend to the parent to have themselves try to practice mindfulness, and if mindfulness is something that's very difficult for them, to even take to notice their emotions more, and to be able to take a time out from the situation if they're very reactive. Now, most of the time, even if at first one is not good at noticing one's own emotions, this can be taught. This is something that we can work at. So actually helping a parent to understand that they too need to be mindful of their own emotions in order to be the most effective parent they can be for their child is really important. And sometimes that means being able to go to therapy yourself, taking that time for that self-care that will, the trickle-down effect will improve the behavior of your child.
Mm-hmm. Had a question posted that there are several parts to, but I think it's a very interesting concept, if you would talk about it a little bit. A listener asked the question about whether or not you would recommend that children, and she doesn't specifically talk about age here, so I'm not sure, that we teach children to track their triggers to their emotions so that they learn to watch for them. And then there's an opportunity then after the fact, if something occurs, to look back at that tracking that was done and see how behavior might be modified. Have you ever any recommendations about that?
Absolutely. That is a fantastic idea, and that is something that we do all the time in therapy, is we ask kids and teenagers, always teenagers, but anyone from 5th grade and up, we usually ask them to try to track their emotions. And actually, now with the newer smartphones, not that all kids have those, but they have things where there's apps for tracking emotions.
Mm-hmm.
Even just taking a notepad and having them write down immediately following that trigger, when it happened, why it happened, what was going on, what emotion they felt, how long they felt that emotion, and the key is to try to get the child to do it when it happens, because often what you'll find is that they'll be willing to do it at the end of the day before they're going to bed, and they can't really remember what happened. But if you are able to prompt your child to mark that trigger down and write a little bit about it, that is an excellent way to become more mindful and aware of what is going to cause a flood of negative emotions. And then eventually the child will be able to react differently in those situations.
Okay, thank you. Is there any evidence, or actually I think you kind of touched on this now too, is there any evidence that children with ADHD have more difficulty controlling their emotions? It seemed to be a co-occurring disorder, as you mentioned, so there would be some evidence about that then.
Yes, absolutely. Actually, the manual that we use as psychologists to give diagnoses to children is currently looking at a potentially new disorder that might be introduced into the next version of the manual, and it's basically about children who have extreme temper outbursts. And in these studies where they've been looking at whether or not this should be considered a diagnosis, 95% of the children in some of these studies have been found to also have ADHD. So when we do see this extreme difficulty with emotion regulation, it typically co-occurs with a diagnosis of ADHD. However, when we have a less severe presentation of difficulties with emotion regulation, it can come along with a lot of different difficulties like anxiety, depression, all different kinds of problems can co-occur. However, ADHD is a very common one.
Okay. This next question, I have to interpret it as I'm assuming it's about a teenager. But the question has to do with getting past the anger that seems to show up when you ask your child about their emotions. So again, I'm assuming this is a teenager who just doesn't want to answer those kinds of questions.
Right. And that kind of difficulty might be something that is best treated with a family therapy if it is a severe emotional reaction. Now, if this is just a typical, I don't want to talk to you about this because it makes me uncomfortable, there may be ways that you can notice as a parent that you might be asking in a way that aggravates the child. You might be able to ask your child how you can check in with them, like explain very genuinely that you want to know how they're doing and that you want to ask about how they're feeling and how could you do this in a way that wouldn't make them upset, and that taking that approach of asking them for advice on it might change the way they respond. But if it's a continuous difficulty that is a reflection of other problems in relating between family members, that might be something that could be helped by going to therapy together and having an objective person in the room to help navigate that.
Okay. How do you encourage a child to take ownership of his situation and helping him really understand how his behavior impacts the relationships around him and get him to buy in, to be willing to work at it?
Often that's a lot easier than you would expect. Most children, even younger children, really do care about the people in their lives that are important to them. So if you ask them how they think that this might upset their mom or their dad or their sister or their brother, and this could be a parent or a teacher asking this question if they have a good relationship with the child, often you'll find that when the child is not upset and angry, they care very much about making sure that the person that they care about isn't hurt. It's that they have to then be able to be reminded when they're in the situation where their emotion is rising that this is like this is the same as before. You're not a different person now. You don't have different goals. You don't have different feelings about your family just because you're angry. So to better own the emotion is to basically make a more concrete declaration of what they care about and who they care about when they're not upset. Because as we can imagine, when people become upset, they lose sight of their long-term feelings and goals and are much more caught up in the way they feel in the moment. And they might be reminded of what they said when they were calm.
Okay.
I don't know if that answers the question.
Well, it was, I hope so. Can you talk a little bit about handling a situation when the behavioral reaction to the consequence is worse than the original misdeed? And I'm wondering if maybe the consequence is too strong.
That's a possibility. So I've had the experience in the past where sometimes the consequence does not fit the crime, as one would say. And in those cases, especially with teenagers, the teenager will completely either give up on trying at all, or they will have an even worse reaction. So first, to consider whether or not the consequence might be too strong. But the other possibility is that the child has learned that if they resist the consequence, that they'll get out of it. So you have to see whether or not this is about the consequence being too strong, or if it's that when they have such a reaction to the consequence, the parent doesn't have the emotional resources to follow through and therefore gives into the behavior, and then they achieve their ultimate goal, which was not to get in trouble for the behavior.
Okay. All right. I think we've gone past our 8:30 mark. I think we have time for one more. And this has to do with fear. So the question has to do with fear being the root of this child's anger. And the question has to do with whether or not this is common. Do you find fear being a trigger that that seems to be a problem for kids?
Yes, actually, very often in younger children especially, anxiety is expressed as a temper tantrum or an outburst. So that is a very common presentation of fear, especially in younger children or in any age child who doesn't have the resources emotionally to express it in a more adaptive way. So we do, the research has shown that this is a common way that fear is expressed. But it's not the case for all kids. So some kids are genuinely angry, and some kids are fearful, and they look like they're angry.
Mm-hmm. So fear then isn't necessarily afraid of, the boogeyman. I don't mean that kind of fear then. This could be fear of almost anything then, something they're not even expressing.
Exactly.
Fear that something bad is going to happen or something like that.
Like fear of separating from their parent, or worries about a test at school tomorrow, or worries about not being able to do their homework well enough and they have a tantrum and a meltdown because they're so anxious about how they can't finish their homework.
Okay, so anxiety, really.
Anxiety in general.
Play right into that then. Okay.
Absolutely.
Well, we have, I think we're going to wrap it up for tonight. We've gone over our time. Dr. Ryan, thank you very much. I'm sorry we didn't get to all of the questions, but I think there'll be plenty of things for you to cover on the chat board.
Okay, great. Thank you so much for having me.
My gosh, thank you. It's been a pleasure.
Thank you. Me too.
Thank you all for joining our webinar on emotion regulation. There is an exit survey which we need everyone attending to fill out. The discussion board is now open and will be available for the next 7 days on the NJCTS website for any questions that were not covered in tonight's presentation. That website is www.njcts.org. Also, an archived recording of tonight's webinar will be posted to the website shortly. This ends tonight's webinar. Thank you, Dr. Ryan, for your presentation, and thank you for everyone attending. Good night.